House MD ran for 8 seasons, and most people only remember the same few iconic episodes. But there are 12 episodes that are so good they make the famous ones look amateur, and most fans haven't seen them. Starting with one that asks the most disturbing question about human relationships you've ever considered. Season 5, Episode 17, The Social Contract, introduces us to Nick Greenwald, a respected book editor who seems like a normal, successful guy until a brain tumor completely destroys his ability to filter his thoughts. One day he's politely editing manuscripts, the next day he's telling his wife that her cooking is terrible and she's gained weight. But it gets way worse than insulting dinner. Nick starts telling brutal, devastating truths to everyone around him. He tells House's medical team exactly what he thinks of their incompetence. He destroys his relationships by revealing every negative thought he's ever had about his loved ones, and he basically becomes a walking nightmare for everyone who interacts with him. The genius of this episode is how it forces every character to confront the comfortable lies that keep relationships functioning. House's team realizes how much they normally hide their true feelings about each other, and the viewers start questioning whether honesty is actually a virtue when it causes this much destruction. Nick's condition becomes a mirror for House's own brutal honesty, but taken to an impossible extreme. The episode asks whether the social lies we tell each other are actually necessary for civilization to exist, or if we're all just cowards avoiding difficult truths. House suspects this picture-perfect couple is hiding something that could kill one of them. Clueless, from Season 2, Episode 15, starts with what looks like the most boring case imaginable. Bob comes to the hospital with mysterious symptoms, but he and his wife seem to have the most perfect, loving marriage you've ever seen. They're constantly affectionate, they never fight, and they seem genuinely happy together. House immediately becomes suspicious because he doesn't believe perfect marriages exist. While his team is focused on environmental toxins and autoimmune disorders, House is obsessed with proving that this marriage is a complete facade hiding something dark. The medical mystery keeps escalating as Bob's symptoms get worse, but House refuses to let go of his theory that the relationship is built on deception. He pushes and prods at their marriage dynamics, looking for cracks in their perfect story. The eventual revelation is that Bob is being slowly poisoned by gold from a dental crown, but the real twist is that House's cynicism about human nature was completely justified. The perfect marriage was indeed hiding secrets that were literally killing one of them. This episode shows how House's misanthropy, which usually seems cruel and unnecessary, sometimes reveals dangerous truths that everyone else is too polite or optimistic to investigate. House becomes obsessed with a case because it's identical to one where he let a patient die. Season 2, Episode 17, All In, brings House face to face with his worst nightmare, a young patient whose symptoms are eerily similar to an old case that resulted in death. This isn't just another medical mystery for House. It's a personal battle against his own guilt and regret. House becomes completely obsessed with solving this case, refusing to follow normal protocols and bending every rule in the hospital. His team watches him spiral into an almost manic determination to get the diagnosis right this time, because he can't live with the possibility of making the same mistake twice. The episode is built around mounting tension as House races against time, not just to save the patient, but to prove to himself that he's learned from his past failures. Every wrong turn in the diagnosis feels like it's leading toward the same tragic outcome that haunts him. What makes this episode special is the rare vulnerability we see from House, who usually buries any signs of regret or emotional pain under layers of sarcasm and intellectual superiority. Here, his desperation to succeed reveals the human cost of his previous medical failures. The case becomes a masterclass in suspense because the viewers are rooting for House to overcome his own psychological demons as much as the medical puzzle. The case becomes personal when one of House's own team contracts the same deadly disease. Euphoria Part 1, 2, from Season 2, Episodes 20 and 21, starts with a police officer who can't stop laughing and experiencing uncontrollable euphoria. It seems like a weird but manageable case until the symptoms reveal themselves to be part of a rapidly progressing, unknown disease that could be fatal. The stakes explode when Dr. Foreman, House's neurologist, contracts the same illness after exposure to the patient. Suddenly, the team isn't just solving a case, they're racing against time to save one of their own colleagues before he dies from the same mysterious condition. House and the remaining team members have to fight hospital bureaucracy, ethical dilemmas, and their own fear while watching Foreman deteriorate in real time. The usual detached curiosity that drives their diagnoses transforms into desperate personal terror as they realize they might lose someone they care about. The two-part episode shifts the entire dynamic of the show, from intellectual puzzle solving to emotional survival. House has to confront his own limitations as a doctor and as a leader when someone under his care becomes the victim of his investigative methods. The resolution is both medically satisfying and emotionally devastating, showing how House's brilliant but reckless approach to medicine can have real consequences for the people closest to him. House spends the entire episode questioning whether his genius justifies all the pain he causes. Season 2, Episode 24, No Reason, is unlike any other House episode because the entire story takes place inside House's hallucinating mind after he's shot by Jack Moriarty, the vengeful husband of a former patient who died under House's care. House spends the episode in a surreal, dreamlike state where he's forced to confront his past decisions, his medical ethics, and the trail of emotional destruction he leaves behind him. The case becomes House's own psychological state as he battles between consciousness and death. Through symbolic visions and confrontations with his colleagues, House is forced to examine whether his brilliance as a doctor justifies the suffering he causes to patients, colleagues, and anyone who gets close to him. Jack Moriarty appears throughout his hallucinations, representing all the people House has hurt in his pursuit of medical truth. The episode becomes a philosophical exploration of House's character, asking whether genius gives someone the right to be cruel, manipulative, and emotionally destructive. House has to literally fight for his life, while also fighting to justify his entire approach to medicine and human relationships. This psychological thriller forces viewers to question whether they should be rooting for House to survive, or whether the world might be better off without his particular brand of brilliant cruelty. A child's body is aging into adulthood while her mind stays innocent, and nobody knows why. Act Your Age, from Season 3, Episode 19, presents one of the most disturbing cases in House's career. A young girl who's experiencing premature puberty with no clear medical cause. Her body is rapidly developing into adult physical characteristics, while her personality and mental state remain completely childlike. The case challenges House's team with rare diagnostic paths as they try to figure out what could cause such an extreme hormonal imbalance in a child. The medical mystery is complicated by the heartbreaking contrast between the girl's physical appearance and her innocent, confused reactions to what's happening to her body. House becomes unusually protective of the girl, perhaps seeing something of his own lost childhood in her situation. The case touches on themes of innocence, the pain of growing up too fast, and the cruelty of medical conditions that steal childhood experiences. The eventual diagnosis reveals a rare hormonal imbalance caused by accidental environmental exposure, but the solution feels almost secondary to the emotional journey of watching a child grapple with adult physical changes she doesn't understand. This episode stands out for its blend of medical complexity with genuine warmth and humanity, showing House's ability to connect with patients who remind him of vulnerability and innocence he's lost in his own life. House has to save someone's life using only a computer screen and people who aren't doctors. Season 4, Episode 11, Frozen, presents House with one of his most challenging cases, Dr. Maydia 26. Kate Milton, a psychiatrist stranded at an Antarctic research station who's experiencing mysterious symptoms that could kill her before any real medical help can arrive. House has to conduct his entire diagnosis through video conference calls, guiding Kate's colleagues, none of whom have medical training, through complex diagnostic procedures and treatments. Every mistake could be fatal because there's no backup plan and no way to get her to a real hospital. The isolation of the Antarctic setting creates incredible dramatic tension, but it also allows House to form a rare emotional connection with Kate. Their interactions are marked by intellectual banter and flirtation that reveals House's deep loneliness and his longing for understanding from someone outside his usual circle of colleagues. Kate serves as both patient and her own medical proxy, following House's instructions while also challenging his assumptions and methods. The distance between them heightens every moment of the diagnosis, because House has to trust other people to be his hands and eyes. This episode showcases House's diagnostic genius in its purest form, stripped of all the hospital politics and team dynamics that usually complicate his cases. It's just House, his mind, and a dying woman who needs him to be perfect. The team is solving a mystery illness when they discover one of their own is dead. Simple Explanation, from Season 5, Episode 20, starts as a standard medical case with Charlotte bringing her terminally ill husband Eddie to the hospital, only to mysteriously fall ill herself. The team is juggling a complicated diagnosis when they're hit with devastating news that changes everything. Dr. Kuttner, one of House's team members, is found dead in his apartment in what appears to be suicide. The medical case continues, but the emotional focus shifts to the team's struggle to process sudden, inexplicable loss while still trying to save their patients. House's reaction to Kuttner's death reveals his complete inability to accept that some mysteries can't be solved. He becomes obsessed with finding a logical explanation for the suicide, refusing to believe that someone he worked with could make such a decision without leaving clear evidence of their reasoning. The episode weaves together the devastation of losing a colleague with the ongoing medical mystery, showing how life's most difficult questions aren't always medical. The team has to continue functioning professionally while dealing with grief, guilt, and confusion about someone they thought they knew. This episode stands out for its realistic portrayal of how sudden loss affects workplace relationships and the way people struggle to find meaning in senseless tragedy. House has to practice medicine with a gun pointed at his head by a patient who's given up hope. Season 5, Episode 9, Last Resort, traps House in one of his most dangerous situations when Jason, a desperate patient with a lifelong undiagnosed illness, takes House, 13, and several other patients hostage at gunpoint in the hospital. Jason has been suffering from mysterious symptoms for years without getting answers from any doctor, and he's reached the point where he's willing to risk murder charges if it means finally getting a correct diagnosis. House finds himself practicing medicine under extreme duress, forced to make life-or-death decisions while a gun is pointed at his head. The episode becomes a psychological battle between House and Jason, with both men using their intelligence and desperation as weapons. House has to diagnose Jason's condition while also managing the hostage situation and protecting the other patients in the room. 13 is pushed to her physical and emotional limits as she assists House while dealing with her own Huntington's disease diagnosis. The life-threatening situation forces her to confront her own mortality while helping House save everyone in the room. The claustrophobic setting and moral ambiguity create incredible tension as House tries to balance his medical ethics with the reality that one wrong move could get everyone killed. How do you diagnose someone who can't tell you what's wrong and doesn't want to be touched? Lines in the Sand from Season 3, Episode 4, presents House with Adam, a non-verbal autistic boy who's suddenly experiencing unexplained pain but can't communicate what's wrong or allow doctors to examine him properly. The case forces House and his team to completely rethink their diagnostic approach since they can't rely on patient interviews, verbal feedback, or even basic physical examinations. They have to find creative ways to understand Adam's condition without violating his need for routine and personal space. House develops an unexpected empathy for Adam, perhaps recognizing something of his own social isolation and misunderstood behavior in the boy's condition. House becomes Adam's advocate, defending his right to dignity and agency in a medical system that wants to override his autonomy for the sake of treatment. The team struggles with the ethical implications of treating someone who can't consent to treatment and doesn't want their help, even though he's clearly suffering. The case becomes as much about respecting Adam's humanity as it is about solving his medical problem. The eventual solution, a reaction to a removed mattress tag, demonstrates House's attention to overlooked details and shows how the most complex medical mysteries sometimes have surprisingly simple explanations that everyone else missed. A trauma victim specifically asks for House because she knows he'll understand her pain. Season 3, Episode 12, One Day, One Room, forces House into an uncomfortable situation when Eve, a rape survivor, comes to the clinic and specifically requests him as her doctor, refusing to see anyone else. Unlike most House episodes, the main case is psychological rather than medical. Eve doesn't need a complex diagnosis. She needs someone who understands pain and won't try to comfort her with meaningless platitudes or false optimism about healing. House is completely out of his comfort zone because he can't hide behind medical procedures, diagnostic puzzles, or sarcastic humor. Eve sees through all of his usual defense mechanisms and demands genuine human connection from someone who spent his career avoiding emotional intimacy. The episode takes place mostly in a single hospital room, with extended conversations between House and Eve as she processes her trauma, and he's forced to confront his own emotional scars. The breakthrough comes through empathetic listening rather than medical intervention. House helps Eve find a small measure of control and catharsis, but the process forces him to examine his own relationship with pain, memory, and the possibility of healing from psychological wounds that never fully close. The patient becomes a living mirror, showing House's team exactly who they really are inside. Mirror, Mirror, from Season 4, Episode 5, introduces one of the most psychologically fascinating patients in House's career, a man known only as John Doe, who has a rare neurological condition that causes him to unconsciously mirror the personalities and behaviors of everyone around him. As House's team takes turns interviewing the patient, each doctor sees their own traits reflected back at them in exaggerated form. The patient becomes a psychological mirror that reveals the hidden dynamics and insecurities of House's diagnostic team. When aggressive team members interview him, the patient becomes aggressive. When insecure doctors talk to him, he reflects their anxiety and self-doubt back at them. The medical case becomes a commentary on how personal identity is shaped by the people around us. House realizes that the patient's condition is exposing truths about his team that they've been hiding from themselves and each other. Each interview reveals something new about the doctor's personalities, ambitions, and psychological vulnerabilities. The episode uses this inventive narrative device to explore themes of empathy, self-awareness, and the way people unconsciously influence each other's behavior. The patient becomes a tool for understanding the complex relationships between House and his colleagues. The diagnosis itself becomes secondary to the psychological revelations that emerge from watching each team member confront their reflected selves. If you want to see the most unhinged House episodes, click the video on the screen.